And while we wait for others to join, we'll just get to know each other. Hello, Nelson from Kenya. Great to see that Nelson is joining us, but not for the first time. We're glad to have you. Hi, Rodney from Uganda. I'm sure Rodney is not the first time because I've been seeing Rodney's name almost every meeting. Hello, Teddy from Zambia. Thank you for joining us. We would get to know ourselves. So feel free to put in your LinkedIn handle in the chat, just so that we can connect outside of the webinar series. We aim to start at about 5 past. So let's just wait for others to join us. Hello, Samson from Nigeria. Bumi as well from Nigeria. Yeah, Nigeria seems to be leading the attendance today. Hello, Teresa from Covenant University, and Hussein from Tanzania. As usual, we're glad to have you guys. So just as a brief recap, Digital Health Africa, in partnership with Academic, has been on this for the last 4 weeks. This is our 4th session. Our first session of this AI in Healthcare webinar series was on the overview of artificial intelligence in healthcare. And then we had another session on the basics of machine learning, and last week on introduction to healthcare data. And today we are having yet another informative session on introduction to healthcare predictive modeling, which a very esteemed guest who will be introducing him in a while will take us through. So maybe just 2 more minutes, and then we'll dive into our main business. Hello, Samson from Nigeria. Shepo from South Africa, Mary from Nigeria. Yes, do leave in the handles to your LinkedIn so that we can connect outside of the webinar series.
Okay, let me get my LinkedIn account.
Hello, John from Netherlands. So as usual, remember that Digital Health Africa is bringing this to you, not just for skill development, but again, also just to inspire certain questions and actions that we hope that will get you on the train to put the digital health agenda in Africa forward. So we hope that you engage. As a reminder, there will be a chance to ask questions at the end of the presentation. And if this is your first time joining us, please do go to Digital Health Africa on YouTube. We have uploaded all of the previous sessions there, and you can catch up on what you have missed. So without further ado, I think we would like to start, especially because today's session is quite interesting. I'll just introduce our speaker. Bye, please. We would have a slide of our speaker up in a minute, so you can see him while we talk about him. Hello, Adeyemi from Nigeria. Abraham from Ethiopia, hello. Thank you for sharing your links. Let us connect outside of the series. Hi, Namdi from Nigeria. We would have the speaker slide up in a minute, so we can introduce him. Great. So we are very excited and very privileged to introduce to you all a professor who would be delivering today's session. Professor Collins Udano is an associate professor of computer science, specializing in artificial intelligence. He teaches at the Department of Computer Science in the University of Nigeria. Throughout his bachelor's degree, his master's degree, and his PhD have all been in computer science and in the engineering, as well as a host of other certifications and trainings that, as you see, make him very qualified to be delivering the lesson that he'll be delivering to us today. Professor Udano also leads a university research group known as the High Performance and Intelligence Computing Group, which is based at the Department of Computer Science there at the University of Nigeria. He has proven to be an innovator in the field of healthcare and digital technologies. So we're very excited to have you today, Professor, and we look forward to learning a lot from you. Over to you, Professor Udano. We're excited to hear you. Thank you.
Thank you very much. Good evening from this part of the world to everyone. I trust you're doing good. I'm hoping also, I'm excited. I'm hoping that we're going to have an interesting time together. Okay, so I want to share my screen so that we can set the stage rolling. Please confirm that you can see my screen.
Yes, Professor, we can see your screen.
All right, thank you very much. Once again, I want to thank the organizers of Digital Health Africa for putting together this webinar and inviting some of us to be part of it. For us, it's still a learning process. So our presentation will follow this format. First, we're going to talk about introduction to healthcare predictive modeling. And to set the stage rolling, we'll look at the AI journey. And we'll look at the history of predictive modeling. And then we're going to look at overview of predictive modeling. We're going to look at some common models and algorithms that can be used. And then we will also, I will share with us some use cases, some of the things we have been doing. And then finally, we look at the ethical considerations to predictive modeling in healthcare. So all this is about artificial intelligence. Artificial intelligence is the base. Artificial intelligence, simply put, is the making machines to mimic and behave like human beings, to do the things that humans do. And the journey to AI began officially around the 1950s. There was a man called, you may have heard of Alan Turing. Alan Turing was regarded as the father of AI. If you have heard of the Turing test, in which he tried to see if the computer would be able to fool a human to think that the computer itself is a human. So he said that if the computer was able to do this, then it means that the computer is as intelligent as man. And then that journey in 1955-56, the term artificial intelligence was officially coined out. And then the progression went to the 1970s. I'm going to share with us what happened that era, and 1980. By this time, computers are becoming more personal and more powerful. And then when we talk about predictive modeling, it involves the use of statistical techniques and machine learning algorithms for us to be able to predict future events Some of them could be something like predicting disease onset, patient outcomes, or hospital readmission rates. And then, so when you look at this, you will see the history of healthcare predictive modeling from 1970s to the 1980s. The first known predictive model was a MySyn, which was an expert system developed by Stanford University to be able to predict the presence of bacterial infection in a patient, and then from 1980s to the 1990s, there were other applications like the Pathfinder. Then 1990s to 2000, then neural networks were introduced into healing and predicting models for disease outbreaks in patients. And then, sorry, just a minute. Sorry, I need to reduce this. Okay. Okay, so that's a brief history of predictive modeling. Then artificial intelligence has evolved over the years. And then we have the following sections, the following areas of or subfields of AI research that are also used in predictive modeling, from cognitive computing to computer vision, machine learning, neural networks, deep neural networks, and natural language processing. Today, there's much talk about large language models, which is the use of a large data set to train them and develop even pre-trained models that are used in language modeling. And that's why today we have the likes like ChatGPT and a good number of them that are coming up. So as we progress, I'm going to make reference to some of these in the works we have done and what we are doing currently. Now, what is the importance of predictive modeling in healthcare? When we use AI to model the likelihood of disease onset, we are able to make an enhanced decision backed by data, because one of the strengths of predictive modeling is data. The strength of AI is data. Just like we are as human beings, we learn over time by acquiring data. I always illustrate with examples of when the children begin to grow up and they are being taught letters, and you try to associate the letters with objects, images that they can identify easily. From there, they begin to grow to understand that letters can be put together to form words and then find the meanings. The same way, machines are trained with data. And when we do this, one of the things that we gain is enhanced decision making. Also, it's in healthcare, it helps us to achieve improved patient outcome through early detection of diseases and personalized treatment plans. Because if we know a patient's history, health record, we could be able to predict his health pattern or disease pattern, and it will help us to be able to carve out a personalized treatment plan for that patient. Another thing is increased operational efficiency, not just only on the personnel or the patients, but also in allocation of resources in the hospital or clinic environment. So AI can help us to be able to, when we apply predictive modeling, we're able to optimally use and allocate resources, and of course, we reduce costs in the end. What can you predict? Almost anything in the healthcare. You can predict the presence or absence of heart disease, kidney failure, and so many of them. But in predictive modeling, we need to know the components that make up a predictive model. First of all is the predictors, which is what we call the independent variables, such as age, gender, medical history, lifestyle factors, because these are the things that influence the outcomes of what we get after the prediction. Because the second part of it is the outcome, which is the dependent variables, which may mean we want to know if a person has the likelihood of mortality in a patient based on the degree progression from our model, or the likelihood of somebody contacting a certain disease by way of lifestyle based on what we have seen from our predictors, or the possibility of readmission and how soon, how many months, how many weeks will it take for such a one to be readmitted. And at the center of it all is the algorithms that we use for developing these predictive models. These are the computational methods that we use. We're going to see a good number of them. New models are coming up on daily basis. Some models are more adapted to specific type of predictive modeling. Some are general. Some can be used in prediction, some can be used in classification, some can be used in clustering. So here we see the types of predictive models listed here. It could be classification model, which is to say that a certain entity belongs to class A or class B or C, as the case may be. It could be clustering, where we want to automatically be able to segregate the components into different clusters or groups. And time series, forecast model, and so on. Then here we look at we see the life cycle of predictive modeling. Like I said, data is the king. Data is at the heart of it all. So the first step is that we need access to data. We need access to data. I'm going to look at some of the, I'm glad that last week the issue of data was talked about. So the data is important. How good your model is depends on the quality of data set you have. So there are different data sources where we could acquire data from. We're going to see them briefly. And then when you've gotten the data, you need to prepare it, you need to do some pre-processing, you need to do some scaling or averaging, as the case may be. And then the next phase is where we now begin to select the features that we may be interested in, because we may not be interested in all the features, or I say it in another way, all the features in a data set may not have the same impact on the predictive model. So we could use some methods like covariance analysis, LDA and PCA, so on, to choose those values that are important, and we're able to rate the level of their importance. And then we select those key values that will be able to predict the model appropriately, so as to not overrun the machine with unnecessary values. Then the third stage is, of course, is the model building. This is the point where we train the machine, which is the process of machine learning. Where, of course, in this field, you will understand that you have to do a split of your data set. The most popular splits are 70 to 80, where you take 70% of the data set for training or 80% for training, while you leave 20 or 30%, as the case may be, for the testing, so that after you have trained the data set, and then you now expose the model to the other remaining 30 or 20%, as the case may be, to see if it will be able to perform well with this unseen data. Okay, so we have at this level, we have the option to select the most appropriate algorithms for the prediction, for the building of the model. And of course, this model, after being built, and we have evaluated it, and we've seen that we've gotten it to a point where it can no longer be refined any further, then we can confidently deploy this model as an app. We can deploy them as app, even as mobile apps or in the cloud, where a user can enter a value, the required set of value, and the system and the model will be able to predict accurately as it has been pre-trained. Then we could get our data set from some of these sources, summarized as in the from electronic health records. We can get comprehensive patient data, which will also include their medical history, lab results, treatment plans, and the likes. So by the time, each time the patient goes to the clinic to consult with a physician, the time it takes some questions from the physician or consultant, those information recorded in the electronic health record. We can also get information through the wearable devices and remote monitoring. Some of them could be something like a glucometer, a blood heartbeat, ECG, or CCG, as the case may be, CEG rather. So we can also get from health surveys. One of the applications commonly used is the REDCap application. At our research institute, at Avan Research Institute at the University of Nigeria Teaching Hospital, we make extensive use of this REDCap to collect data from patients across different parts of the country, and they are all stored in the cloud. Okay. Then let's look at some of the common algorithms and techniques for building predictive model. We have the decision trees and the random forest. These are one of the simplest algorithms that we can use to classify, the outcome of the prediction. And then in the process of the building of the model, we also check the accuracy. Sometimes also we could combine more than one method, more than one algorithm to have an ensemble learning. Neural networks and deep learning is being extensively used today, especially when we have to do complex pattern recognition, like in the application of computer vision, where we take images and the model is expected to identify the presence of perhaps maybe a pathogen, a presence of a disease, like we can take carcinomia, for instance. If we look at maybe skin infection, we can use a high resolution camera to get that data, and having trained a model, the model will be able to classify or to predict if this redness of skin or some blast, if it is a known disease, it could predict that perhaps this is a tumor or whatever, and then be able to classify it to say this is the category it belongs. And we may be able to say this is the degree of the growth and things like that. So when images are passed through a computer vision algorithm, we'll be able to do some of these things I've said. We also have the support vector machine, which is effective for high dimensional data, and it is good for binary classification. For instance, you want to say, detect the presence or the absence of cancer in a patient, or from perhaps from images, or from the other parameters you've gotten. Then we have a logistic regression, which is which predicts, classifies whether true or false. It's a binary outcome that it gives you. We have also the Quarks proportional hazard model, which predicts survivability or the survival rates. We have Bayesian network, which is a probabilistic model. It comes from the area of statistics. It can be used for diagnosis and risk assessment. Now, I want to look into some use cases of what we have done using these models. The first one is disease prediction and diagnosis. Chronic diseases like diabetes, heart disease can be diagnosed and predicted based on the individual's lifestyle factors that we know, perhaps from their medical record. So we could be able to predict the likelihood of developing a chronic condition, just like diabetes or heart disease. And in this use case, we developed a model that we call a machine learning model and application for heart disease prediction using prevalent risk factors in Nigeria. We got the data set, heart disease data set, from the Federal Medical Center, KEFI, Nasarawa State, Nigeria. Through consultations, when individuals come for consultations, they interfaced with our data collector, who asked them some questions and got some parameters, 13 variables. And these parameters, the dependent variables, include things like sex, gender, age, whether if the person is diabetic or not, weight, height, if it is hypertensive or not, then genetic history, perhaps family history. That is looking at those things that predispose such one to heart disease, because some of these are genetic. So we got about 720 instances of records. And then we applied the following models. Some of the ones I've listed: decision tree, random forest, naive Bayes, and voting ensembler classifiers. And then at the end of the training, we got the best performing models to be the decision tree, the naive Bayes, the random forest, and the voting ensembler classifier, with the following accuracies and error rates. The higher the accuracy, the lower the error value you get. So for decision tree, we had 95.83% accuracy, and error of 0.042. For naive Bayes, we had 97, and it goes on like that as it is shown. Now, what is the application of what we have done? This can serve as a decision support system for a consultant, since we built this as an app, it could be a mobile app. The consultant can ask a patient several questions to extract these variables, these dependent variables that we listed, such as age, gender, diabetic, height, and all those stuff. And then he keys these things into the app, which has been pre-trained. The model has been pre-trained. And then this app will predict the likelihood of this person having or developing a heart disease. So that is the application of this model. Then I go to use case number 2. Use case number 2 is built on fuzzy logic. Fuzzy logic deals with imprecision or membership. It helps us to represent things as they are in the real world. So the research is on fuzzy logic rule-based approach for the diagnosis of kidney disease. Fuzzy logic is a rule-based system that takes a number of rules and finds the conditions that match those rules. In this research, we gathered our data set from the Kogi State University Teaching Hospital in Igba. And the dependent variables we got were things like blood sugar, systolic, diastolic, blood pressure, age, body mass index, and smoking status. So we worked together with some consultants, some specialists in renal disease, and they advised us and helped us to build the model. And the model was implemented using the Mandani fuzzy inference system. So the choices are made and potential hazard modeled. So we had over 1,716 rules, but we later reduced these rules to 80. And in the process of testing these rules, only 11 of the 80 rules were able to fire. When we say fire, it means that the conditions that made them to work were fulfilled. And so at the end of it, we got a diffusification value of center of gravity of 223.8, which shows that, which predicts that from the factors given for a particular patient, the likelihood or the kidney state or the infection state or the risk state is about 23.8%, which is mild. So with this, a consultant, a doctor, will be able to predict the outcome and to be able to say for sure that this is a likely state of this disease, and then be able to advise appropriately. Our use case number 3 is based on time series modeling. Time series models, most popular is the ARIMA model. It's used for predicting future values based on historical time series data, just like predicting pandemic and all that. So we employ this during the COVID-19 pandemic. Our work was entitled An Evaluation of the Frameworks for Predicting COVID-19 in Nigeria using the time series data analytics model. We got our data set from the Johns Hopkins University and the Nigerian National Disease and Control Center in Nigeria. And then this live data, we use disease pandemic model, such as the SIR model, the susceptible, infective, and recovered model, to predict. What were we predicting? We were not predicting if there was going to be COVID-19, because COVID-19 was already there. We wanted to know the transmission rate. We wanted to know how fast is it being transmitted across the country. You know that if you pay attention during the 2020 pandemic and lockdown, if you follow the figures, notice that some countries had very high transmission rates. Countries like Italy, China, the United States, and the like. So we were able to predict the R0 value, which is the reproduction rate or the transmission rate value. And then we got a value of 1.22. And using this, we predicted that there was going to be a peak of the transmission rate or the infection rate on the 24th of June, 2020, which was day 90. All right. So, and then we used values because you need to use the population density, or the population of the country or the community where you are predicting the infection. Okay. So we got a maximum peak of the value of 386,654.4 transmitting. That's which amounts to the rate of, to 0.2% of the population. Okay, so we actually use a regression model to confirm the accuracy of our prediction, and we discovered that it was very significant. And we actually checked the transmission number of confirmed cases during this period. It is something that you can check on the NCDC website and see if these values that we predicted were so or not. We got an accuracy of 94.18%. Okay. So who can use this? What's the application of this? What's the application of this? The application of this is for health workers and government to be able to take some certain actions. We recommended in our study that if the lockdown is extended, we will still reduce the R0 to less than what we predicted it to be. And if social distancing was also adopted, we can also reduce the transmission rate. And good enough, Nigeria had maintained this value until the lockdown was over. So the next predictive modeling use case we did was based on deep learning models. Deep learning, as I said before, helps us to handle complex tasks, to be able to manage them. They are based on the deep neural network. Now, in this case is called deep learning algorithms for predicting the geographical locations of pandemic disease patients from global positioning systems, GPS trajectory data sets. There were actually two works we did on this. The first one was also during the pandemic, where we got 15 patients who volunteered to be part of the study. We developed the model and installed them as app in mobile devices. And as the person who is with the mobile device is moving, we are seeing on a dashboard, we are getting in real time the movement, the locations of the person. So through this, with these 15 persons, we're able to generate a data set of 157,218 trajectory data set over a period of 3 weeks. So there are places that are stay points, places that you usually find the people, places like shopping malls, marketplaces, and this could be called hotspots, so that this could be used to trace. Remember that during the COVID, there was this issue of contact tracing. So this was important to keep tab on a patient who has been confirmed to be infected. All right. Then the second work we did was where we now use deep learning algorithms, which includes the recurrent neural networks, the LSTM, and convolutional neural network. We use this now to predict this movement of a pandemic patient. All right. So we found a good number of the models, the algorithms performed very well. Okay, so what are we doing now? I've given us a background of some of what we have done some time ago. Currently, we are working on the classification of cervical cancer images using computer vision. We so far have gotten over 350 images of cervical cancer. And then we also have some data set also that contain risk factors that predisposes somebody to get infected with cervical cancer. So we're going to do two things in this research. One is the classification, being able to classify the images we have to show the presence of cervical cancer. And then the second thing is to be able to predict using the risk factors if a person will be predisposed to cervical cancer. So as I round off, there are challenges. We are not saying that all these things will go smoothly. There will be challenges. And one of the challenges in AI research is ethical consideration. Ethics is one of the things that is being preached recently in AI. Issues of data privacy, bias, transparency, and so on and so forth. So as we do predictive modeling in healthcare, we must also bear in mind the ethical consideration of our research such that we do not infringe on people's rights and such. So another challenge is data quality and availability. You'll agree with me that getting health data set is like getting a camel to pass through the eye of a needle. So because one is that not many are funded, but those that get funded, the data sometimes is not easy to get by. And in this part of the world, we do not have so many of these data sets, so that at times we have to rely on the data sets that have been built in the global north. So, but curating data sets is very expensive. It needs to be funded. All right. The third thing is interpretability and transparency of the models. The models have to be understandable. Whatever we do has to be explainable to the layman. It could be the doctor, it could be the patient, it could be the healthcare person. So these are some of the things that we should put behind us at the back of our mind when we are considering predictive modeling in healthcare. So with this, I conclude. And I stress on the importance of predictive modeling. It's important. It will help us to reduce time to diagnosing a disease. It will help us to also reduce resources that are being deployed, all right? And then the potential impact it has on patients and the healthcare system is huge if we can adopt them, all right? So what is the best algorithm for predicting a model in healthcare, predicting healthcare model? There is none. It all depends on what you want to do and the size of data and all that. Many a times, the best model is a combination of different algorithms to have an ensemble, and then you'll be able to get something that works. So with this, I want to thank you for your attention. And these are the references to some of the use cases that I have cited during my presentation. Thank you very much for listening.
Thank you very much, Professor. Thank you, Professor Udano. This just permit us to say that you are par excellence, because you have simplified something that was so complex and so abstract and given us in a way that we are able to relate to. Thank you, Professor. This has been an honor. I'm
Thank
just
you.
hoping that our audience can leave reactions for you. Let's just give Professor a round of applause for that very informative session. So just as a recap, as usual, Professor told us a lot of things, but he reminded us that what predictive modeling really is using statistical techniques and machine learning algorithms to predict patterns or outcomes based on pre-existing data. He went ahead to emphasize the importance of this field, especially within healthcare, tell us that it enhances decision making in healthcare settings, especially because this decision is data based. It enhances patient outcomes because we're able to predict patterns and occurrences before they occur, and so we're able to prepare for them. And it also it enables better planning and resource allocation just because we're able to kind of see the future before it happens. But I think that the highlight of Professor's presentation really was the use cases that he gave us, that he and his team have been working on. Heart disease prediction using prevalent risk factors as the predictor variables, kidney disease diagnosis, COVID-19 transmission prediction, and geographical location of pandemic patients. And there was another one on cervical cancer classification. It's just, I think that the highlight that we should take from this is like work is being done when it comes to AI in healthcare. Prof and his team are Africans in Africa doing real work in the field of AI in healthcare to solve real African problems. African problems that they're not abstract, they're not from the West, using our data sets. I mean, he's giving all the details, he's giving the processes. I'm really, if you're not inspired by that, no, we know you're inspired by that. So I think that we can use Prof as a kind of time to connect, to say that we want to be this, we want to contribute to this because we're seeing others making a difference. So Prof, right now we'll move to we'll have a series of questions. Just so you know, there's a lot of applause and positive feedback from the audience for you, which we're not surprised about because it was a brilliant presentation. And if you're ready, maybe we'll just take the first question.
Go ahead.
Okay. So the first question is from Dami, and Dami wants to know, how does someone confirm that the data available is of quality?
Okay. Thank you very much for that question. Yes, there are processes you follow to refine data. One of them, there are so many of them, but let me just speak on. There is, for different type of data you get, there are acceptable ranges. All right. For instance, you know that if you are measuring blood pressure, for instance, there are known ranges. So when you get values that are perhaps running in negative values, minus 100, you know that certainly that's not a correct reading. Or you get values that are running way above the range, you know that that is not a good value. So that's one of the ways, knowing the acceptable ranges. And then secondly is also looking at the consistency of the data in the records you have. If you have the ones that are out of range more, then there's a problem with the data set. But if you have a few outliers, that a few of them, for instance, like the example I gave before, that you are looking at data from blood pressure, and you get a few of them that were negative values, or you get some of them that were reading 200, 500, you know that those ones, if those ones are few, you know that those ones are outliers, and you can easily eliminate such ones. Another thing you also need to do is you also need to look out for missing values. If there are missing values in the data set, what percentage of the data set has missing value? And good enough, you have tools that will enable you to check if these missing values exist. And then you look at the number of missing values, and there are methods to deal with such missing values. So I won't say, I think these are some of the things you need to do to test the quality. And of course, you need to also have a balanced data, all right? So that the data is not skewed on one side. These are some of the things you need to do to have qualitative data. And of course, that data has to be large enough for it to be something you can use to train a model that can be generalized. If the data set is too few, the possibility is that the model will quickly overfit and give you a very high accuracy. But when you test it in real life, you discover that it is not giving, it is false. So these are some, I hope this helps. Thank you.
Thank you, Professor. Thank you. And my mother from the chat is just from the audience is just re-echoing a contribution. And mother says that some features, some ways to assess data quality are to remove or replace missing values, just like you said, remove outliers, assess feature relevance, assess consistency of data, which again is just in line with what you said. So we'll send over the next question. Please, I would like to know if it is possible to make the past data sets you have used available.
Yes. Yes, it is possible. On request, we can make it available, depending on the one you're interested in.
This is
yes.
So Prof, we are the audience is asking if it's possible to have your email or maybe your LinkedIn handle, just so that they can get in touch for this kind of inquiries or other ones.
Okay, I'm putting on my email address here. It's simple, collins.udano@unn.edu.ng. That's it. Okay.
So Dare.
Okay. All right.
Okay, so Dare, you can get in touch with Prof through that.
Yes,
and
with this you can find me also.
Derek as well, who wanted Prof's email. Okay, and Shepo is asking. Shepo is one of an audience member who has been with us from the very first session, and he's saying thank you, Prof. Udano, for a very insightful presentation. On a reflection, I can reflect by saying the future of AI in healthcare looks promising. With advancements in deep learning, natural language processing, and robotics, AI has the potential to transform healthcare delivery, improve patient outcomes, and reduce healthcare costs. However, it is important to note that while AI can augment human capabilities, it cannot replace healthcare professionals, and the collaboration between AI and human experts is crucial to ensure the safe and ethical implementation of AI in Africa. So these are his thoughts, but Prof, maybe do you want to say something a bit about replacement of humans by AI and that collaboration? Okay.
Yes. This debate always comes all the time. It's true. I totally agree with all what he has said. AI is not a substitute for humans. AI is an aid to help us to make our work easier and faster. And one of the things that we advocate in AI system development is that there must be room for man in the middle. The human beings must, we don't just take everything the way AI says it is. There must be a provision where humans have to supervise those predictions, those results, and test them with real life values. Because especially when you come to healthcare, you are talking about human lives. I'm yet to meet anybody who has two lives. And so we need to be very careful how we handle it. So I think I'm very much support of what he said. Thank you.
Okay, thank you, Prof. So we have another comment from Rose. No, from Dami again, sorry. Dami is saying, is it possible to have a fit all case study model? And Dami says, I'm Black and a model was trained on a data set with white people. Can their model work effectively in Africa? Can our model work at their end?
Okay, thank you. Number one, there's nothing like a one-stop shop, one model fitting all. There's no way it's going to be possible. If what you mean is if we have one model, the model is able to predict diabetes, predict cancer, predict heart failure. No, it has to be specific to the application. And your second question, why this is the reason why we're advocating for indigenous data sets. If you train your data set with data from Caucasians or Asians, there are some things that are different genetically, that are different across different human beings from different climes. So you cannot, for certain cases, it will be, I think there will be few cases where you can use one data set and generalize. There are just few cases. So that is why it is better to have these things domesticated in wherever the environment that you are predicting or the people who are concerned. That is why I'm still insisting that much funding has to go into data collection in Africa. Thank you.
Right. Thank you, Prof. So the next question is from Chinedu. He says, excellent presentation, Prof. Thank you. And he says he agrees the use cases that you presented were very interesting. Now, can you walk us through how you and your team decide on which use cases for predictive modeling to work on in Nigeria and Africa? What factors drive your decision making?
Okay, thank you. Okay, the use cases sometimes are based on either interest or the prevailing situation. For instance, the cases I've shown you concerning COVID were because at that period, COVID was a global problem and that everyone wanted to find a solution to it. And then that motivated us to go into that use case. And then some also as a result of demand or perhaps the interest of the researchers. If we have, because some of this work were done in conjunction with PhD or graduate students. So if you could have a student who is interested in a certain area of application of AI in healthcare, and then we can look into that. And then these are some of the motivations that drive us through it. And then if the process of selecting the model depends on the kind of problem you want to solve. For instance, let me use two examples. One is you want to know the presence or the absence of a certain ailment. For instance, diabetes. All right. So that will tell you that the kind of model you should look for, the kind of algorithm you should look for should be classification algorithms, things that will tell you if it is there or not. And there are a whole range of classification algorithms that will help you to build a classification model. And so you can, what we normally do is to take a collection of some of these algorithms and run them as an ensemble set, bring them together, and then evaluate them and see their performances individually. And at the end of the day, we find out the one that performed most, all right? Or if we're going to have a combination, or you may have 2 or 3, maybe out of 6, 2 or 3 doing very well. You could either work with those ones, or you can subject them to further training by trying to fine-tune their performances using some boost algorithms like XGBoost and the rest of them. And then that will now tell you the best performing algorithm. All right. So that's that for classification. Right. And then you want to predict, want to forecast if this is going to happen. Then that tells you have to look for regression models. Okay. So these are some of the things that inform us on the choice of algorithms to use. But you need to know these algorithms, you need to know their characteristics, you need to know their strengths, you need to know their weaknesses. especially in handling the type of data. I forgot to say that the type of data you are dealing with is also important. If you are dealing with numerical data, or you are dealing with what do you call it now? What do they call it? Nominal values. Also, those will tell you the kind of. It will also help to inform you on the best algorithm to use. I hope that helps.
Wow. Thank you so much, Prof. And let's not be lost on us that Prof said one of the ways that these use cases are chosen is, via graduate students. So maybe, Prof, just to echo some thoughts from the audience, you may be expecting that some members of our audience or their network, would like to write to you about some of those graduate opportunities, work with you, because if you want to contribute in this field, it is clear that maybe coming to work under your supervision is one of those ways. So we hope that you and your team are open to that.
Sure, we are.
Right. So our next question is from Rose, and Rose wants to know what is the difference between experimental data and predictive data?
Say it again. The difference between
experimental data and predictive data.
Okay. There's really nothing like predictive data. Experimental data, these are data you collected while performing experiments. Okay. Maybe you have subjected your entities, maybe this, which will be patients, for instance. Maybe you are taking their weight, or maybe you want them to jump up or run a short distance, and then you take some measurements, or measure height, BMI, and all that. So once you've done that, those kind of data are experimental data. You can even use IoT or wearable devices that as the target audience, as the patient is doing some activities, you are recording that value in real time. Many times it can be sent to a cloud repository. So you are getting that data. That's an experimental data. The person is living his or her normal life, but you're interested in the condition of the heart, the blood sugar, and things like that. These things are coming to you from the wearable device. All right. Now, from this data set, you can now build a predictive model. The purpose of this is to say that I'm using this data set I've gathered to predict if XYZ is going to happen in the life of this person. So there's nothing actually like predictive data. Every data you get could be used to predict an outcome. Thank you.
Right. Thank you, Prof. So we have another, Prof. We hope you're not tired yet. We do have another question from Dare. Dare has been very engaging today, so thank you very much, Dare. And Dare would like to know, can we trust the inside of these models due to their black box nature? Probably asking about the capacity to predict or the predictions that they make due to their black box nature.
Sorry, can you take it again? Sorry, I didn't get it. Hello?
So Dare is asking, can we trust the... Hello, Prof. Yes. Can we trust the inside of these models due to their black box nature?
Okay. Yes, we can.
The predictions that... Okay.
Yes, and that's why we're at towards the tail end of my presentation, I talked about some challenges. These models, with the issue of interpretability and transparency of the model, this is where it comes in. All right. When you are developing this model, you're actually following scientific processes. And these processes are processes that should be repeatable. You get the point. And of course, I said that you test these models and see the kind of results they are giving you also, not just the value that you use for training them. All right. So if, for instance, I've given an example before, if the model is predicting your next blood blood sugar level, all right? That value has to be consistent or close to what you used to have, or what, except something exceptional happens. And that's in rare cases. So these things are traceable. These things can be monitored. These things can be proved. So you can actually test the results, the predictions with real life data and see if they are consistent with practice. All right.
Okay, all right. Thank you. That is noted. So we have another comment and question saying, thank you, Prof, for the wonderful presentation. This is coming from YouTube, I think. My question is, could you educate us more on the collaborative efforts being made by the Nigerian government, the medical profession, as well as AI professionals in academia in Nigeria in terms of local funding, research, and development of local solutions in this field?
All right. Yes, the one I know very well is the TED Fund, the Tertiary Education Trust Fund, which awards which handles the National Research Fund for academics. They have been consistent over the years. I have been a beneficiary of such one of their calls. So they are very much consistent, and it's a government owned agency. Government established this. And with this, colleagues, people in the academia, even though it is highly competitive, very competitive, but people get it. Every year, a good number of colleagues get it in my institution and then across different parts of Nigeria. So it's an effort that government has made all in that to help advance scientific research. And then also talking in terms of collaboration and AI development in Nigeria. Incidentally, I was part of a team that was constituted by the government to formulate AI policy in Nigeria between 2022 and early 2023. And we came up with a number of different areas of AI to formulated national policy. And these are efforts also that the government is making. And they got different people from different areas of profession. We had lawyers in our midst and the rest of it. Then also the NIDA, which is a government agency that led the artificial intelligence policy formulation. They have also set up, they are setting up artificial intelligence centers across Nigeria. It's a proposition which the current minister is driving. He's passionate about artificial intelligence adoption in Nigeria. So I think works are going on at individual, institutional, and at national level. I believe that with time, there will be more opportunities, more fundings, more collaborations. And I think it's going to be a positive outcome for us. Thank you.
Thank you, Prof. That's encouraging to hear. And would like to have you take one last question, just because we are running out of time. And this question is coming from Damilare, who is asking, why was ARIMA considered over other forecasting models like SARIMA, exponential smoothing? I'm just curious.
Okay, well, I will not be able to give those details now, but it's an option. These models vary only a little, but ARIMA is I would say, is the most popular when you are doing a time series analysis. And secondly was that there was when we did this research, there was this pandemic modeling that was developed in R, you know R, and then it was built on ARIMA model. All right, so we use this pandemic model to develop this to predict the R0 score or the infection rate when we did our research. So I think these are the reasons why we chose ARIMA.
Thank you, Prof. And thank you again for this presentation, which was very enriching. We can see from the questions that you have gotten us excited, which was really the purpose of this entire webinar series, to get people excited and inspired in these things, especially because we're seeing real work that is being done by you and your team on the ground. So to Rose and everybody asking, if you're interested in what Prof is doing and you want to collaborate, please just write to him. His email is in the chat. You can copy it and reach out to him after this. He said he's open to read from us. He's open to hear what we have to say. For those asking about the slides, just to say that, like we said from the beginning of the webinar series, at the end of the webinar series, we would compile all of the resources and hand it over to everyone who was attending. Again, Prof, I just want to say a big thank you, because you have clearly made a difference with us here today. And thank you for being open to further collaborations. We want to promise you that at Digital Health Africa, we're probably going to be reaching out again, because you're clearly a value source and would like to keep in touch. Thank you very much.
Thank you so much. Thank you for having me. I'll be more than willing. Thank you.
Yep. Thank you, Prof. Thank you.
Thank you.
So about the certificate again, at the end. Right. Great. Thank you, Prof. So we would have one last, yes, and my LinkedIn. I just dropped the handle to my LinkedIn on the chat. Thank you for asking. We would have our next session next week, Thursday, which will be the last session of the series. Thank you very much to everybody, especially those who have been with us from session 1. It's amazing that we are on our 4th session today, and that next week is going to be our session finale. So please endeavor to join us then. It will be on Thursday, the 30th of May, 4 p.m. same time, same link, which will be on case studies of AI applications in healthcare. Promises to be very interesting. So please join us, because again, it will be a kind of capstone of everything that we have learned, and a kind of way forward, and answering questions and just rounding off this session. Again, please connect with us on social media. Our number is on the screen, our email, our website, for both Digital Health Africa and Academic. From all of us at these organizations, thank you to everyone. And please do not forget to join us next week. Prof, just so you know, there's still a lot of positive feedback in the chat saying insightful session. Thank you. And of course, to our audience, we feel very privileged and honored to have brought this to you. So thank you, everyone, and see you next week.
Thank you.
Right. Thank you.
Are you ready to revolutionize healthcare in Africa? Digital Health Africa, in partnership with Africa Canada AI and Data Consortium, welcomes you to the AI in Healthcare webinar series starting May 4th. This groundbreaking webinar series will be taking place every Thursday and Friday throughout the month of May. Led by experienced instructors and industry professionals, this series is designed to equip healthcare professionals and students with essential AI knowledge and skills. From understanding